Watch as this provider takes a sexual history from a female patient. What do you think the doctor could have done better?
Hi, I'm Dr. B. Are you Sharon Morgan?
Yes, I'm Sharon.
Well, you'd like to be called Sharon?
Yes, please.
Okay. So, what brings you in today?
Well, I just started dating someone new, and I'd like to get STD testing done so that I'm good to go.
Okay. Do you know when the last time that you were tested for HIV?
I think it was about 2 years ago.
Did you also get tested for other STDs?
I think so.
Okay. So you have sex with men?
Mostly, sometimes women. I like exploring.
So you're bi?
I guess.
All right. So I'm just going to ask you about condoms. You always use them, right?
Most of the time.
Good. That's good. You mentioned you had a new partner. How long have you been sexually active with him?
Derek, about 3 months.
And including him, how many partners have you had in the last year?
3.
Are you currently using contraception?
Just the condoms. I had taken birth control, but I stopped about a year ago because it made me feel bloated and I kept missing it.
Oh, that's too bad. Have you ever been diagnosed with an STD?
No.
Do you use any drugs?
I smoke cannabis.
How about cigarettes?
No.
And alcohol? Do you drink alcohol?
Socially.
Sharon, any other medical problems, medications you take, allergies?
No.
All right. Well, anything else you want to let me know about?
No.
Well, let's get these tests done. But before we do, just a couple of thoughts that I had. You know, if you're not going to use contraception, it's really important that you use condoms all the time. You don't want to get an STD or get pregnant, do you?
No.
What did the provider do that limited their ability to collect a complete sexual history? What could they have done differently? We noted they did not elaborate or offer examples when the patient was not sure of a question. They did not question or elicit more details in the examples of STD testing, types of sex, other partners, condom frequency, or drug use. They made assumptions about the patient's behavior. They asked presumptive, closed-ended questions. They were judgmental. They missed opportunities to educate and discuss HIV prevention strategies, including PrEP. And their advice was critical and unrealistic and did not engage the patient. Here is a more comprehensive and open way of taking a sexual history.
Hi, I'm Dr. B. Are you Sharon Morgan?
Hi, yes I am.
Is that what you'd like to be called?
Yes, please.
What pronouns do you use?
She and hers.
That's what I used to. What brings you in today?
Well, I just started dating someone new, so I'd like to get some STD testing done so that I know I'm good to go.
Are you having any current symptoms?
No, I'm not.
Okay, just want to make sure. Any fevers, weight loss, throat pain, rash?
Oh, no.
Discharge, pain when you go to the bathroom?
None of that.
Okay. And do you remember the last time you were tested for HIV?
About 2 years ago?
Did they test for STDs as well?
I think so.
What samples did they take?
Blood tests.
Did they do any swabs of your throat, vagina, or rectum?
No, but I did go to see my gynecologist 6 months ago, and we did a pap smear.
So who do you have sex with?
Mostly men, sometimes women.
Do you consider yourself bisexual?
No, more so pansexual. I like exploring.
Nothing wrong with that. What types of sex do you have?
Vaginal.
How about any oral sex or anal sex?
Oh yeah, oral. I've had anal sex, but not recently.
How often do you use condoms?
Most of the time with a new partner, but then after we get comfortable with each other, they kind of go away.
All right. You mentioned that you have a new partner. How long have you been sexually active with them?
Derek, about 3 months.
Okay. And are you sexually active with anyone else right now?
Not currently, no.
What types of sex are you having with Derek?
Vaginal and oral.
And including him, how many partners have you had in the last year?
3.
Are you on contraception right now?
Just the condoms. I had taken birth control and I stopped about a year ago because it made me feel bloated and I kept forgetting to take it.
Yeah, that's no fun. Are you interested in taking a different contraceptive method?
Possibly. I just don't want side effects.
Here is when the provider would discuss contraception, which is not covered here.
Have you ever been diagnosed with an STD?
No.
Do you use drugs?
I smoke cannabis.
Okay. Anything else?
No, I tried ecstasy and coke once a couple years ago, but nothing recent.
Okay. And have you ever injected drugs?
No.
Do you smoke cigarettes?
Nope.
How about alcohol? Do you drink?
Socially.
How often?
On the weekends, 1 to 2. I really don't drink that often.
Okay. And do you have any medical problems I should be aware of?
No.
Do you take any medications?
No.
Any allergies? Mm-mm. It's pretty easy for me. Do you have any questions for me?
No, I don't.
Okay. And is there anything that you wanted to share that I didn't ask you about? Okay. So let's get these tests done. Just have one question for you before we do that. Have you ever heard of PrEP or Truvada?
I've heard of PrEP. That's the pill that gay men take to prevent HIV?
Yeah, that's right. Gay men do more often take it, at least in the United States, but it's actually for anyone who's sexually active who might be at risk for HIV.
Do you think that I'm at risk for HIV?
Based on what you've told me, I don't think so, but I like all my patients to know what their options are for them and for their partners and friends.
Okay, well, thank you. I'd like to hear more.
Great.
What did the provider do to make the patient feel comfortable and allow for more open dialogue? We noted they provided examples when the patient was unsure about an answer. They followed up at times during difficult questions. They did not make assumptions or judgments. They matched the patient's language. They used open-ended questions. They opened up the dialogue to discuss HIV prevention strategies and PrEP. If there is time, you can also ask the patient about where they met their partners, if they discussed HIV/STI testing with their partners, or if they exchanged sex for goods. You should also discuss what tests you are performing.